Everything was completed.
Hey, this is Sports Slaw with Lomas Brown, the pro.
And Deb Schneider, I'm the prof. And together, we're the pro and the prof. Okay, we got to change that opening.
I know. I know.
Ray loves it.
I know. Yeah. How are you today?
Good. It's been an interesting week all around. You know, lots of things happening. We're getting back to normal. CDC came out today and said that you can not use a mask if you're vaccinated.
Yeah, that's great. It seems like we're pointing in the right direction. You know, everybody seems to be doing their part. People are getting vaccinated and people are wearing their masks. So yes, this is a glorious day that the governor got the chance to make that type of announcement, and the CDC.
Right. Yeah. I mean, it's a big deal. We'll get back to sports. We'll get back to somewhat normal, hopefully. But again, you know, shout out to everybody, get those vaccinations.
Yes, please keep getting the vaccinations, keep doing your part so we can really get things back to normal.
Mm-hmm. And I think a big thing is, unfortunately, it's been politicized, but realistically, you know, I worry that even though I'm vaccinated, that I might shed enough virus to give it to somebody else who's not vaccinated.
Yeah.
And it's for me as well as for everyone else that I get vaccinated.
Yeah. And just for the people that are afraid of it and people that are still on the fence about it, you know, it's been a lot of people have gotten, I think, well over 100 million have gotten vaccinated. Now they're starting to do the younger kids now. So, you know, if you have that fear of doing it, it's a lot of us have done it. And I'm saying it for myself. I feel good. I didn't have any side effects. And I feel emboldened because now, you know, I feel like I'm fully vaccinated. And, you know, it gives you a sense of, you know, accomplishment.
Right. And I will say, Lomas and I actually saw each other for the first time
That's
in
right.
a year.
Yeah. Yes. We've seen each other in person. I got a chance to hug Deb. So yeah,
that was exciting.
Yeah.
I know. It seems like it shouldn't be exciting, but it was exciting.
I know.
So yeah, and you're an ambassador for the vaccinations.
Yes, I am. Yeah, and I'm a proud ambassador. I'm an ambassador for the Oakland County. Again, we've had 2 or 3 campaigns to where we're having people to mask up, get vaccinated, and the same even with the governor. I was there when the governor brought her daughter to come to Ford Field and get vaccinated. And it's just spreading the word, Deb. And it's a good word to spread. That's something I have no problem with being an ambassador about, because it's a good thing to spread the word about getting vaccinated and protecting people.
Right. That's a big deal. So I'm proud to say I know an ambassador for the vaccination.
I feel like I should have on
one of those little crowns.
Yeah, I need a crown being the ambassador. Thank you.
That would be great. We'll have to talk about that. Tonight, though, we have Marla Gendelman, Dr. Marla Gendelman, who is an anesthesiologist, a pain doctor, and an expert in cannabis medicine, talking about pain and what we can do with CBD, THC, pot, marijuana, blah, 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 blah. So, and just to tell you, Marla and I have been friends since we were 12 years old, 11, 12 years old. Right.
11 maybe.
Right. And she actually did something with all the biology that we took. So I'm really, really proud and happy to introduce my very, very good friend, Dr. Marla Gendelman. to talk to
Thank
us
you.
about cannabis and pot. And don't tell anybody about the stapler.
Oh,
Okay,
he just
so
did
here's the
that.
story
Yeah,
about the
yeah.
stapler. Somehow, I think it was Mrs. Robbins. You were holding a stapler.
That's her name. That was her name.
Yes.
Mrs. Robbins.
Yes. You were holding a stapler. She
Right.
stood up and she accused you of stapling her in the head.
And she hit
Oh.
it. And she hit it. So it was.
So it was partly her fault, huh,
yeah.
Marla?
Yeah, I'm the lawyer. I would defend her. I
I was in
defend
the
her.
wrong place at the wrong time.
Any detention, anything came out of that? You had to go to the principal's office.
Did.
Do you recall what
think I
happened
did,
after
actually.
that? You did.
I remember that. You had to go to the principal's
Did
office.
I, Deb?
Yeah,
I think
you
I
did.
did.
Yeah.
I did.
Yeah. In the middle of the fruit fly experiment or something.
Oh my
Oh, the
goodness.
Drosophila. Oh, yeah. I had to relive that one in college during my genetics exam. They were flying around.
Oh, geez.
I got a question about that. I
were.
know this is totally crazy. Why are they so hard to kill? We're talking about fruit flies, right? Is
Yeah.
that why are
I
they
hate
so hard to kill? Oh my goodness.
Marla, welcome to
I
Sports
should
Law.
have
We
asked the
talk all
exterminator
things
when he was
sports.
over the other day.
Yeah. Yeah.
I think they
Wow.
just keep laying eggs and hatching. And then when
Okay.
you think you've got it, they hatch again.
Oh,
Right. Short lifespans. I think that's the key. Short lifespans.
Yep.
yeah.
And just keep laying eggs. And it's just, it just keeps going and going.
Wow. Yeah, they are annoying.
Yes.
Man, yes. We get off on so many subjects. I like sports law. Talking about fruit flies.
Fruit fly. So let's talk about pot for a minute.
Yeah, okay.
So, I mean, there's so many things to talk about with cannabis and athletes, and we want to really, Marla, we want to really pick your brain, or Dr. Gendelman, Dr. G. We have Doc R, we have Doc B, Doc Marla, but just picking your brain about cannabis and athletes and the use of it. And I guess my very first question is really the different, what do you think about using cannabis with athletes? Which is probably a 30-minute question.
It's very, it's pretty broad.
Yep.
I think there's various applications. I think the thing that comes to mind for most people is pain and recovery.
Mm-hmm.
And I think that's probably what it's used for most commonly, is helping with injury and recovery and things along those lines. But it can be used for issues of anxiety, social anxiety, and to, in some sports, focus and tune out extraneous things. Is it performance enhancing? I think that truly depends on your sport and what you're trying to accomplish. It can increase your heart rate and increase your oxygen consumption. So it wouldn't be considered performance enhancing in something that requires, speed and those sorts of, and endurance. But
Yeah.
maybe in other things.
Yeah. And, Deb threw out some numbers. Deb, if you could kind of go through those
It was
numbers.
amazing.
But
Those
I'm not
numbers are
shocked,
amazing.
Dr. Marla.
No.
I'm not shocked, but me being an ex-professional football player, it was, especially back in the 80s, 90s, it was, I would say back then, probably 75 to 80% of the guys on the team used, I was a guy that used too at times. And, again, it was more so for the pain recovery. I was a guy that when I was at the University of Florida, I was on Motrin a lot, and it actually started eating the lining of my stomach. The Motrin did, the ibuprofen.
It absolutely does. It'll
Yes. So for me,
give you
it
an
was more of
ulcer.
a recovery. Exactly right. And right now I'm suffering with Barrett's disease because my flap doesn't close all the way. And as you know, if you don't treat the Barrett's disease, it can become cancerous. So, to that point, that was one of the reasons why I seen it too.
I'm not laughing at the
Deb, I
I'm
know
laughing
what you
about
are.
the fruit flies.
Only Ray, only our
Only
Ray.
Ray.
Still the fruit flies.
Yeah,
Yeah.
yes. So I'm not as shocked, especially in professional football, that was why the numbers were so high. But the resistance that the guys are still facing today, I think is more shocking to me, meaning the stigma that's around it, that the NFL won't allow these guys to use it today without being penalized. And, they push the opioids and you could get those freely, but a lot of guys want to move away from the opioids and the lasting effects that can have. And they want to move more to a natural drug that can kind of help them decrease some of the pain. I mean, in your mind, I know why the stigma, but why do you think the NFL is having such a hard time moving away from that, where they're not punishing guys for using marijuana?
It makes no sense. I have a question about the use of steroids in professional sports. Because that's the other thing. I'm not talking about performance enhancing, but when you get enough steroids, like Medrol kind of stuff, you can do anything, but you can hurt yourself. And that's the other problem. So CBD is twice as anti-inflammatory as steroids, but it's not destructive. It doesn't give you an ulcer the way steroids do. It doesn't give you an ulcer the way non-steroidals do. And the only issues are maybe a little bit, it's metabolized by the liver, so you have to be maybe a little bit careful if you're taking things like cholesterol medicine. But its safety margin compared to things like opiates and steroids and any other things, non-steroidals, is huge compared to what the alternatives are. And there's just a lot of resistance, and a lot of it's the stigma of the federal issues. I know that's true in hospitals, it's true professionally in a lot of other arenas, I guess.
That's a really interesting thing that you said. I mean, getting back to some of the numbers, when I was looking it up, they say 50 to 90% of NFL players are users. They're saying 85% in the NBA. I don't think the Major League Baseball is as widespread. However, we know that they still test, but you can't be high when you're on the field, supposedly, and you can't be sponsored, but they're removing it from the list of drug abuse. The NHL, is saying we're looking more for confidentiality and for treatment. NFL is everybody's pulling back, I think, because legally marijuana seems to be sweeping the country from a state perspective to be legal either from a medicinal purpose or from a recreational, depending on the various states. Right. Either one. States are different. Federally, it's still illegal. And I think that really puts the leagues in a bit of a conundrum because they don't know how to deal with it. But one of the things that you mentioned, Marla, was the safety margin. The
safety margin is amazing, and that's in terms of risk mitigation alone. There's no question, and it's just that it's been the stigma, the federal laws, the classification as a narcotic without medical use. So those are issues. There's been no research, so the American doctors are slow to adapt. The research has been in other countries, in Europe and in Israel, but it's not widely available and it's not widely known in this country, so it's not widely accepted. But it's slowly changing.
Yeah, it really is.
Slowly.
And you said
it really is. And there's
No, go ahead. Go ahead. Dr.
go ahead. There's different forms to use it. I mean, I think that we get caught up in the whole idea of, is it in your system at all? The problem with marijuana is it lasts in your system for weeks. And there's the issue of, are you using it at the time of performance or game? Or are you using it afterwards in recovery and it's staying in your system? And there's no good way to test for that. And drug policy needs to come around to reality.
Yeah.
Basically.
I think one of the biggest things and one of the biggest differences you talked about a little earlier was CBD compared to it. I mean, how the use of CBD has really taken off, you know, for pain and for different things.
CBD is not intoxicating, and an athlete could be using that either, you know, orally or topically, or even using THC topically for muscle recovery or pain control, but they're going to test positive for it because enough THC is in their system for the testing issues. So, but in terms of performance, if you're only ingesting CBD and you're using THC topically, it's not going to appreciably affect your performance in terms of oxygen consumption, heart rate, those types of things.
But there's still only one test to find.
There's one
out.
test that's very, very non-specific.
Okay.
And generally, you know, it's a urine test, or if it's a blood test, that's just as non-specific.
Now, between opioids and Lomas, correct me if I'm wrong, but my impression is that when somebody's hurt, there's a lot of opioids that might be prescribed, or like you said, Motrin, which of course leads to other issues. You know, Marla, you're the doctor for, say, the Lions. You know, a small little professional football team. What do you prescribe?
Why a lot of opiates are used, but yeah. I'm not a big fan of opiates, but I know that's a lot of what, you know, it's legal. That's the problem. It's easy to get your prescription pad out and say, this is what you need, this is how much you need, and this is how often you need it. And the challenge of marijuana is it's not so simple to do that at all times. And the other challenge being a lot of doctors just have no idea how to advise somebody. So the athletes end up trying to figure it out on their own, as do a lot of patients. So, but there's other forms. I mean, I think we think of marijuana and we think of somebody smoking a joint or a bong, but there's many out here. I brought my props. There's topical, there's tablets, and there's tablets that are not intoxicating. Because if you use THC in its acid form, it's not intoxicating because it hasn't been heated, but it's very, very anti-inflammatory and will help pain without intoxication. So a combination of THCA and CBD can really help pain and inflammation without being intoxicating. I have a CBD too.
Yeah.
Will you still test positive though on the urine test?
Well, you will still test positive, but that's our problem right now. There's no like breathalyzer test for it that's any good anyway.
Yeah.
Of acute intoxication, you know.
Yeah. Do you see that changing? Do you think they'll change that as far as the testing of it and everything?
They've been working on it, but they've been working on an inhalational type of test, but it has been fraught with issues of inaccuracy, complete and total inaccuracy. So.
I'm sorry.
I don't even wants to join the podcast. So, but now, Lomas, there are a lot of athletes now who are saying that they'd rather use CBD on a regular basis from a training standpoint or from a pain relief standpoint, as opposed to using some of the maybe a steroid or an opioid. How does that play with the NFL and the testing and
Well,
what they're looking at?
yeah, just like what Dr. Marla said, that, again, it's not, I don't think it gives you a competitive advantage. So, unlike steroids,
doesn't.
which will, it just doesn't. So to me, why not? I think the NFL should, and I think they will, because it's becoming, like you're saying, it's sweeping the nation. It's starting to become legal in more and more states. For instance, Deb and Dr. Marla, if you're on the team, say like when the Lions travel to Colorado, or maybe I better not pick the Lions because it's legal here, but a team that's in a state
team
where it's
that's,
not legal,
not.
where it's not legal at, when they travel to
Tennessee
Colorado,
Titans.
there you go,
The Tennessee Titans.
Right, and we talked
Exactly.
to Des Fitzpatrick, who was just
that's right,
just
exactly
drafted.
right.
So last week we talked to Des, who was just drafted to Tennessee Titans.
Yes, you're right. So when they travel
It's
to
still a
states where
prohibition
it's
state.
legal, yes,
Yep.
but they have to get the talk. They have the NFL security comes in and they get the talk about what they can and can't do. Oh yeah, because again, you're traveling to a state, so they don't want guys, going to these dispensaries. You're not allowed to do that. You're still under scrutiny of NFL rules, where marijuana is illegal right now. So that's an extra talk that the coach has to give the team, or give his team before they travel to states where it's legal at now. So again, it's just little things with the NFL where it was just like with gambling. Before the NFL accepted casinos and accepted gambling, it was the same way. Anytime you went to a state where they had casinos at, they would always pull you to the side or have that talk with the team saying that you're not allowed to go into casinos. That's still prohibited by the NFL. So those are some of the things that affect teams that are not in states where it's legal at right now.
You know what I love best about this is sometimes I feel like I'm in the locker room.
Yeah.
I get the I get the what really happens that we don't actually hear about.
Yes. There's so many things that go on in there, but that's one of the things that go on.
It amazes me. I would never know that.
I mean, for all the listeners from a sports fan perspective, this is, the stuff that you never hear about.
Yes. And Dr. Marla, I would say this too. Basically, the NFL, they gave you pretty much, they would tell you, okay, we're going to test you it used to be from the end of March till it would be till May. So they would basically tell you, look, basically stay clean those 2 months, because we will be testing in between those 2 months. Other than that, you're good to go. So they were even breaking it down to where they would tell the guys the time period that they'll be tested at. So all you got to do is stay clean in those 2 months, and you would be good to go for the season. They don't test you during the season for marijuana. They randomly, they randomly test you for steroids and other enhancing drugs. You get a random test for that, but marijuana, they don't test you for that. So, unless you're in the program, then you get tested. Yes.
Good. So everybody really wants to know, the big question is, how long does it stay in your system?
Yes.
Because everybody's looking for a job. A long time. What's a long time?
A long time. It depends how much you use it. If you are a daily user, it can stay in your system up to a month. If you're say a weekly user, it may only stay in your system, maybe a week or two. It really depends on how much use you have and how much body fat you have.
Okay, because that's the question that in the employment world, we're still drug testing, and we're still looking at marijuana as
we
an
are.
illegal substance. Yes. You know, we don't do alcohol testing.
I know.
Yeah.
Right. And we don't do opioid testing.
No, we don't.
You know, so we're being asked here, are there masking agents that people use?
Not ones that are effective all the time.
Okay.
No, I mean, that's true. And there's a lot of stuff that's sold, but there's no guarantees. It's just got to get out of your system. I mean, you know, a lot of water might help, but then you might be giving them too dilutive a sample, and then they might be upset with you for that. So,
Yeah, you're so right about that. Yeah. Yeah.
oh yeah,
you're
it's
so
got to be,
right.
you know, it has to be the right temperature. It has to be the right concentration.
Yes.
That's the
It's
key.
I don't know if you ever heard of a Wizardnator, but yeah, one guy got busted for having one of those. So yeah, I mean,
There's
they
ways to
right.
attempt to get around it.
Yeah.
Yeah, but I figured they were probably watching. You know, is it observed? You know.
Well, you know what, Dr. Marla, that's a great point. So when I first got in, my first year in the league was
I'm not supposed to
1985.
say that. The doctor's not
No,
supposed
but
to say that part.
no, but you're
No,
right.
but it's true.
They
Yeah.
didn't watch. They didn't watch, and of course, guys were, you know, doing all kind of stuff. I remember they had a story out about this famous college player where he would take an IV bag, tape it to his back, and run the IV tube, you know, between his legs and get away with it that way. So the NFL started making you strip down to your underwear. You can only go in there with your underwear
way.
on. Then that was it. They were making sure because guys were coming, like you said, guys get creative.
We're getting
and everything.
creative.
Yes.
Yeah.
So now they got a guy just standing there, Deb, that's looking like this now. So
Well, it's a job.
I said I never wanted
Performance
that
anxiety.
job.
Oh, wow. Yeah. Not a job. I think.
No.
Any
Yeah,
of us would
that
really
is a pretty weird job.
Yes, that is. We call him the P Man. Oh, here comes the P Man, and he would stand there and he would watch you. So
How
things
was work
change.
today, honey?
I know.
Oh my gosh. Okay, so let's turn a little bit. The benefits of using. Now, one of the things that I've seen in, you know, from an NHL standpoint, from an NFL standpoint in particular, are the fact that they're saying there are some benefits actually from a CTE perspective, which is a huge issue in both of those leagues. Can you speak a little bit about that?
Oh, yeah. So cannabis.
That would be a softball question, right?
Cannabis is neuroprotective, and it's neuroprotective by helping the helper cells within the brain called the microglia. So by helping the microglial cells function better, your whole brain functions better. The microglia is responsible for removing toxins and the lymphatic drainage of the brain. So they're really huge when you're talking about brain damage. So CBD and THC can both help the microglia function better, thus help your nervous system overall, both your brain and your peripheral nervous system function better. And that's a mechanism of how it happens, by both being extremely anti-inflammatory and helping this particular set of cells called the microglial cells, which are sort of the protector cells and the cells that get rid of toxins. So it's good to help them.
So could it help cure CTE or just control it? Because that's a problem with plaques.
It might, it's this kind of situation that it could help Parkinson's, Alzheimer's, all types of diseases that have neuroinflammatory basis. So that would be MS, that would be Parkinson's, that would be Alzheimer's. There's slowly becoming more and more actual evidence in the research that those things might be true, but we need to do studies. But there's evidence that points in that direction, that it may be protective for an aging brain, thus it may be protective after a CTE type incident. Absolutely. I recommend patients with CTE to start the CBD immediately and consider adding THC in the evening to help with sleep, because sleep's incredibly important with traumatic brain injuries as well. If you don't
what
get restful
form?
sleep.
That
Sleeping?
was my question. No, what
Oh,
I'm
in what form? Yeah, I don't
yes,
recommend
smoking
smoking
it.
it.
Okay,
Well,
gotcha.
I'm a doctor. I'm not going to recommend that. I mean, CBD can be, there's oral. You can take it by mouth. You can take it a liquid. You can take it as a caplet or a tablet or a candy. You can take it's topical as well for pain control. Say you have an elbow injury, you put it right on. I put it on my nice arthritic little wrists. And there's vaporizing, which is a form of smoking, which might be a better option than burning things and inhaling them. But, because I am a doctor, I'm not supposed to recommend people smoke. So there's many and many, many other ways to use cannabis. Orally, topically, patches, caplets, liquids, candies. Am I missing anything?
Oh, you covered all of it.
Brownies,
Yeah, the edibles.
Yeah,
Yeah.
brownie.
edibles.
Well, yeah, candies. You make edibles. I say grow your own, make your butter with coconut oil, and then you can cook with it or make it into your own topical.
So
Oh, that's good.
the higher percentage of THC, is that better? Is that better? The higher percentage of THC, or
Oh, well, the weed now, especially even compared to when we were young, is probably got 3 to 4 times as much THC. It's hard to know. We need CBD. CBD is the healing and the more reparative molecule of the two, but the THC helps a little bit more with pain, a little bit more with nausea, and a little bit more with sleep, and sometimes with spasm. So I tend to recommend more a higher CBD and a lower THC. Use CBD more during the day, and when you need further pain relief and sleep at night, save your THC for then. That dog is big.
I know I need to give him some CBD.
And that is something that they do give to dogs, isn't it?
Yeah.
My dog tore his ACL, so I started to give it to him topically on his knee, but he kept eating it off. So then I just give him tincture now because he will not let it. He'll just lick it off.
Okay.
So he might as well just have it in his mouth to begin with.
So someone said to me, there's a difference between indica and sativa.
Indica and
Indica.
sativa.
Yeah.
Indica and sativa.
Yes.
Yeah. So tell me about that, because those are
Well,
two different aspects of a plant, right?
yeah, there's a little controversy if that's always whether there's such a big difference, but cannabis is many different molecules together. It's many different cannabinoids, CBD and THC just being some of them, and then it's an array of things called terpenes that give it its smell and its flavor. And all those molecules like to work together in something called the entourage effect. So that's kind of how it works and how it helps us.
So the entourage effect, huh?
So indicas tend to be more for sleep, more for pain control, and tend to be sedating, or what we might call couch locky. It's more for the evening. And then sativas are more, for some people, can be even energizing and can help focus during the day, but tend not to leave you quite as couch locked and stuck to your chair. So people tend to think sometimes of that as day weed and night weed. But
Is
I
anything
also find
performance
that
enhancing?
some people say that the sativa can enhance concentration and ability to focus. So depending on your sport and what you're performing, that can be helpful. Snowboarders love it, and it's really part of the culture. And it's a more creative kind of sport, so a lot of them feel, it is performance enhancing in that way. But if a drug is increasing your heart rate and your oxygen consumption, is it performance enhancing? It's a very individual thing.
Yeah. And
Very individual.
football is so reactionary. I mean, you have to
I
react. You have to
can't
be
I
P's
can't
and Q's.
imagine being intoxicated on the field.
I know that could be
I mean, I
really
can't
dangerous.
imagine it. I
Yes.
can't imagine it in any sport, really. I mean, I think of it more something for recovery than. I read about snowboarders, sometimes Olympic shooters, using it for focus and to tune out. But those are different sports.
Yeah. But do you
Those
think,
aren't team sports. Those aren't about catching something and.
but does it have a lingering effect? Do you think it has a lingering effect? I know you say it stays in your system for a certain amount of days, depending on how much you do it. But do you think, say, if you did something earlier that day, you think it could have a lingering effect even into the next day on you, where it can affect your reaction to things or your reaction time?
I think that is an extremely individual thing, and that is something the athlete that him or herself can assess best, because your body learns to metabolize it, and really when you use it more, your body metabolizes it better. Thus, you really are not as intoxicated from it as people who use it only rarely. I mean, they've done studies with chronic marijuana smokers and reaction time with driving, and their reaction times are really pretty good when they're not, not when you're talking later on. So that's about the only kind of study I can think of. But it would affect, acutely your reaction time and things like that. So I think if you're in a kind of an elite level sport where, milliseconds matter, I don't think it's enhancing. But it's very individual. So I guess when you think about testing, why should they, if it's not enhancing, why should people be penalized? I don't know.
Which is an interesting question, because the sports test for illegal substances as well as performance enhancing substances.
Right.
And
so
they're
so
really
it's illegal.
It's illegal, and it's
In that
been
sense,
illegal.
it hits the illegal on the federal level.
Right. And that's where I think
And
we
that's
have a
why
lot of
all
issues.
industries test for.
Yep. And we have a lot of issues these days, because illegal on a federal level, legal in some states, not others, legal from a medicinal purpose in some states, from a medicinal and recreational purpose in other states. We have sports throughout all the states. In Michigan, the Lions players can go ahead and smoke if they want, supposedly, and the Tennessee Titans cannot. So it's really a mixed bag. And I think from a legal perspective, it becomes how does the NFL look at this, given the fact that to a large extent, they're a relatively conservative organization, but the new CBA is saying there's no suspension for smoking. And each of the leagues is looking at it a little bit differently, very, very differently. But one of the things that I wanted to ask about was really the long-term effects of use. Because if we have somebody who's been using it for a long time, an athlete, a former athlete, they've been using it, are there any adverse effects from a long-term use?
If you are using it in a smoking way, and that's how you're ingesting the marijuana, yes, there can be cardiac issues and pulmonary issues. So I think it also depends on your route of administration. I think that's very different if you're using things topically and orally. You're not, you're not hurting your lungs. You're not changing you're probably changing your heart rate a little bit, even with oral ingestion. It can increase your heart rate a little bit. it's a little anticholinergic effect. So it can cause cardiac issues, and as you get older, it can cause cardiac rhythm issues. And those are the things we look for. But in terms of its safety margin compared to really so many other drugs, I mean, Allegra D can cause cardiac arrhythmias. It does frequently. As does
Wow.
Sudafed. So, I
Yeah.
mean, Sudafed's huge for causing cardiac arrhythmias. So,
Well,
I mean, when you think
well,
about all kinds of stuff, do all kinds of things.
yeah. Well, that's why I said it was, some players had brought together internal medicine lawsuit. It didn't really catch, hold like the concussion lawsuit did, but you had a group of players that did bring together internal medicine lawsuit against the NFL because of some of the long-term damaging effects that the opioids had caused these players throughout the years. Again, it didn't take hold like the concussion lawsuit did, where it got momentum and they were able to get a class action lawsuit behind it. And I don't know why it didn't. I really don't. I don't know whether it was because it's
I'm not sure
legal.
either because
Yeah.
it's
I
legal.
mean,
Mhm.
Even
it
though we
really
have,
is.
an opioid problem and we recognize we have an opioid problem, it's still used a lot.
Mhm.
I mean, because if they don't use opiates, what are they going to use?
Hmm. You're right.
Can this be a replacement? Can marijuana be a replacement for opioids?
It certainly has a wider safety margin. I think we use opioids too much and we get people hooked
Right.
on them. So, yeah, can it be a replacement? We cannot start them on them to begin with. And I mean, the thing with an opioid is, I mean, I've only ever had them post-op, but you have pain and and you have pain, but the opiate makes you not care you have pain. The thing I see different about marijuana is it changes your pain because it's changing the level of inflammation in your body. It's changing the spasm in your muscles to make it more relaxed. It's changing your pain in a more functional way than making your brain think you don't have pain. And thus, I think it's going to be a lot better, it's risk mitigation. You're going to do a lot less harm with it.
What about the
And
addictive nature?
we have to start thinking about that.
Yeah.
It is not physically addictive the way opiates are. Your body becomes habituated to the opiate, and when you don't have it after that happens, you become sick. Your body becomes sick for the need for it. And that's a real thing, and that doesn't happen with marijuana, not at all like an opioid.
Wow.
You may miss the pain control, but it's not an addiction.
And
But
compared to like a nicotine?
opioid addiction, I don't even think it's as addicting as nicotine because of that. I mean, it's a different thing.
Which is really, I mean, going back,
we
it's fascinating. It's fascinating. This is illegal.
Because, and then the other thing is that the amount that you can ingest of it, if you were to somehow decide that you're going to eat the entire pack of gummies, or, you still aren't going to die if you eat, you somehow decide to take the whole bottle of the tablets. You're just going to get sleepy. And it's impossible to overdose on. I'm not saying that you can't take a lot and do something stupid, but that's true with anything. But overdosing on marijuana is pretty much impossible. So
Yeah.
why aren't we using it? Marijuana stamp back to the 30s, the war on drugs, lots of reasons. Even our treaties and conventions are written making it illegal.
So I think you're blaming the lawyers.
still can't believe you're a lawyer.
I know. How'd that happen? We have a
Said it was
thing.
because you flunked organic chemistry.
It was. Organic chem was my downfall.
Oh, that sounds like another show right there.
That is another show, and I got
does.
a lot of people to talk about
Yes.
organic chem. It was not a good class.
Yeah.
Anyways, we're running out of time. So final thoughts. Marla, Lomas, what do you think? I think this has been a fascinating show. I mean, I've learned a lot, and it just seems to me that it's something that we should look at further. I mean, it seems like there's less risk and some definite upsides. Lomas, you're a professional athlete.
Lack of information.
Yeah. No, I agree. I think, like you said earlier in the show, the states are starting to accept it. It's spreading throughout the states now. And, again, I think every player should have alternatives. Just like you could get two opinions when you have an injury. You can see the team doctor, but you're allowed to go see another doctor. I think you should always be able to have alternatives. Yeah. The doctor may prescribe Percocets or whatever to kill the pain. I think you should be able to have a choice of whether you want to take the opioids or you want to go take the THC route or, the CBD route. I think that should be a choice. And I think the NFL is starting to see that. I really think they're starting to see that. And I think they're going to move towards not just being stuck on the stigma of marijuana, but I think they're going to look more at what it can do for you to benefit the players, because the NFL makes their money by players being out there on Sunday playing the games. And if your product is getting hurt or your product is going on with your product, then I think you have to do any and everything you can to make sure that your product is at its highest peak and they're performing on Sunday. So I do think we're going to see a shift. It's a slow shift, but I think we're going to start seeing a shift with their thinking in the NFL.
Absolutely.
I think that in a way, doctors have an obligation to patients when they prescribe opioids to discuss the risks of opioid addiction and to discuss alternatives. I'm not sure that happens, but I think that is our obligation. So,
I think there's an entire
and it's an
new
alternative.
show. Yeah, I think there's an entire other show on the idea of addiction, what's going on with the fact that there are a number of former players who are addicted to opioids because they were prescribed opioids.
Absolutely. It's a huge problem.
Yes. And it's a
Across
problem
the
throughout
country,
society.
in sports, not in sports, throughout society. That's what I mean. It is it's what's going on. Yeah.
And Dr. Marla, just by you saying that,
it doesn't make any sense that this is what we've done.
Yeah. And just what you said about how it helps with CTE and some of the diseases that former players face once they're out the game. And I shouldn't say former player. I should say players face while they're in the game and while they're
current
out of
players.
the game. Yes.
Parkinson's, MS,
I
CTE.
tell whenever I see a patient who has had a head injury, I recommend that they start CBD immediately and keep taking it through their life. I think that there's evidence out there that it can be protective. And if it were me, I would take it. Oh, I am. My dad had Parkinson's. My dad died of Parkinson's, so I am going to keep taking my CBD.
And on that note, thank you, Marla. Thank you, Lomas. I've learned a lot. Great, great information. I really appreciate it. And, to all of our listeners, if you have additional questions, feel free to send them and we'll get them answered. So check us out on Facebook, check us out on Spotify, send your questions. Love to hear everybody. And thank you again, everybody, for listening tonight.
Thank you.